In healthcare, how humans perform in complex systems is so important, and you have to address the engagement of staff and the employee experience.
What we know at Press Ganey is that all of this work is connected, and culture impacts your employees and your providers as much as it does your patients. And the goal is a highly engaged workforce, because we know that when employees are highly engaged in the work and they're completely bought into the culture, that they will deliver the best care.
When we ask hundreds of thousands of healthcare workers, how do you feel in terms of outward signs of safety in your organization? If they feel pretty good about it, meaning they see their leaders and the organization committed to safety first, both their safety and the safety of the patients and families are taken care of, their levels of engagement jump from the 50th percentile up to the 95th percentile.
We're listening to the employees. They want to be heard. They want a place that they can come and be the best they can be. An organization that respects them and gives them growth opportunities. And so when we come into an organization helping them with safety, workforce engagement, patient experience, it's more than just improving those metrics. We're actually changing the way the care is delivered at a much higher level.
If you think about the work that we do around improving safety, improving quality, improving performance, focus on the human experience, the engagement of team members, those things make the right work easier to do.
The numbers are not the goal. The numbers are really there, and the data is there to guide practice. And so we use that data in a way that's going to help us understand if the work that we're doing, the initiatives that we're undertaking, the improvement work that we're engaged in is really working. And if it's not, how do we course correct?
Well, I find this work very important, and kind of drives me personally is, as a clinician or as caregivers, in your work, you can only help one person at a time. So what if we find the underlying causes, the kind of structural problems, the processes that are making care delivery more difficult, and then we can affect change for much larger patient populations. So what I find when I do this work, you get that meaning on trying to understand how do we help more and more people, and if we can address kind of the underlying issues and kind of challenges they're having from delivering that, those clinical operations or having that care delivery models that are effective, we're able to really create a very, very large change.